I'm Dwayne Westmoreland, Director of Case Advocacy and Youth Engagement at Kentucky Youth Advocates. First, as a Louisvillian and grandfather, I thank Cosair Charities for leading this community in the challenge to eradicate child abuse by 2023. Every day, Cosair Charities is there when it comes to kids. The key to eliminating child abuse in Louisville takes the commitment and involvement of everyone. That includes preachers, pediatricians, educators, parents, nonprofit professionals, early childhood providers, and many others. That includes you, and it includes me. It is tempting and frankly a lot easier to think that fighting child abuse is someone else's job. As a child care professional, you face an array of demands, whether that is a new program, a need from a parent, or adhering to state regulations. You likely take daily steps to protect the children you care for, and we thank you for that. Part of that protection of children means making sure you know how to recognize and report suspected child abuse or neglect. Every day, young children place their trust in you. So I'm asking you, reach deep, think creatively, and place ending child abuse at the top of your professional commitments. Can there be any truer way to honor our professional code of ethics?
I'm Janet Masterson, Executive Director of Community Coordinated Child Care in Louisville, also known as 4C. As a central point of contact for community child care needs, I understand the importance of hiring quality staff who will ensure the safety of children in child care. Child care staff play a critical role in supporting families as they deal with the stresses of raising children. As a member of the Cosair charity Face It movement to end child abuse, I value the opportunity to work with several organizations, all with a common goal: to keep kids safe. By law, child care staff are mandated reporters and are required to receive training on child abuse recognition. We hope this video reinforces information you already know about child abuse prevention. We can all be the face that ends child abuse, and child care providers have a major role to play in this effort.
My name is Dr. Melissa Curry. I'm a child abuse pediatrician, medical director, and chief of the Cosair Charities Division of Pediatric Forensic Medicine at University of Louisville. Child maltreatment occurs in all ethnic, social, and economic groups. It can and does happen in nice families. Photographs are really important, especially for child abuse pediatricians and investigators. So, when possible, help facilitate photographs being taken. DCBS is called the Department of Community-Based Services. That's what we call Child Protective Services, or CPS, here in Kentucky. For the rest of the presentation, I'll be referring to that state organization as CPS. We'll start out by saying a few words about bruises, or contusions. These are the most commonly missed early warning signs of abuse, but they're also the most easily recognizable if we know what to watch for. When it comes to child abuse, it is very, very rare for a child to be seriously injured or killed the very first time that they are abused. This tends to be an escalation of violence over time, and that's why it is so important for all of us who care for children to notice those early warning signs so that we can stop that violence before it escalates. Some of the following pictures may be disturbing to some viewers. The 10-4 bruising rule was developed here in Louisville to help us determine what kinds of bruises are worrisome for child maltreatment and what kinds of bruises are more typical. TEN stands for torso, ears, and neck. So any bruising of the torso, ears, or neck of a child under 4 years of age, or any bruising anywhere in a child under 4 months of age, is very concerning and needs to be reported to Child Protective Services. Here are some additional examples of ear bruising. It's really important to understand that ear bruises are very, very rare from accidental injury. So if we are seeing an ear bruise, that needs to be documented and reported. And as you can see here, the ear bruises can involve multiple different parts of the ear. They can be single or multiple. They can be multiple different sizes. Essentially, any kind of ear bruise is concerning. Here are 2 examples of neck bruises. The neck is a very vulnerable part of a child's body and very rarely injured accidentally. So again, if we see injuries on the neck of a child, particularly bruising, that needs to be reported to Child Protective Services. And then finally, the last part of the rule is probably the most crucial for child care providers because it talks about our most vulnerable population, our babies. Any bruising in any baby of any age is highly concerning for inflicted injury. Bruising in babies is not normal. The two photographs in this slide indicate fairly benign-looking bruising on two different babies, but because that bruising was there and recognized, the babies had the evaluations that they needed, and both were found to have multiple broken bones. So bruising in babies needs to be taken very, very seriously. The rule of thumb is that those who don't cruise rarely bruise, and of course cruising is the developmental stage where children are pulling up on furniture and starting to take steps. In addition to the 10-4 bruising rule, it can also be helpful to understand what normal patterns of bruises are in young children. In general, children tend to get bruises on the fronts of their body over bony prominences. Those tend to be the areas where there's skin right over the top of bone. So the forehead, the elbows, and then the knees and shins by far get the brunt of it. One myth that's commonly perpetuated in the media and in other places is that we can date bruises according to their color. This is really not possible. So if we're in a position of describing bruises that we see on a child, it's important not to attempt to say whether they're old or new. It's better just to describe their color and their location and their shape. This is an example of a common birthmark that's commonly mistaken for bruises. These are known as either Mongolian spots or slate blue nevi, and they can appear on children of any kind of skin pigmentation. It's important to know that these exist because they are sometimes identified in the first few days of a child being at a new child care provider, and they're mistaken for bruises instead of a birthmark. We can simply ask the parents if this is a mark that has always been on the child and see what they answer. You can see here we have a common patterned injury in a young child. He has stripe-like bruises going down the side of his face. He was taken in for medical care with the history of having run into a wall. But in fact, these are slap marks. This diagram shows how the slap marks create that stripe-like bruising. Where the hand is impacting the face, we see linear bruises occur between the spaces of the fingers, giving us that common pattern. Another common patterned injury in young children is the inflicted human or adult bite mark. Now, as many of you know as child care providers, the most common perpetrators of bite marks on little kids are other little kids. However, sometimes we see bite marks that are actually inflicted by adults. So it's important to make note of how big they are and to make sure that the child that we're seeing this in actually has exposure to other young children. Another common pattern injury is the loop mark. Loop marks are caused by belts or cords, foam cords, wire coat hangers, basically anything that's thin and flexible and able to conform to the contours of the body when a child is whipped with that object. You can see two examples on the top where you get a perfect negative impression of the object that impacts the skin. And then on the young man in the bottom, the impact was so violent that it actually took the top two layers of his skin off and he has abrasion in addition to the loop marks. We're often asked by folks who take care of children how we decide when to call Child Protective Services when injuries are involved with physical punishment. As we all know, spanking and other forms of physical punishment are legal in all 50 states. However, although we're allowed to physically punish or spank our children, we're not allowed to injure them in the process. So at the point that physical punishment leaves behind an injury, and that includes bruising, that is when we now have reached our requirement for reporting. There are a lot of contributors to maltreatment, many of which indicate stress in a family system. The most common are domestic violence, criminal history, substance abuse, and then untreated and undiagnosed mental illness. However, one thread that tends to follow through so many of these families is that the caregivers have unrealistic expectations for the child's developmental level. And as child care providers, that is one of the most powerful things that we can do, is helping to educate families about what is realistic to expect of a 4-month-old, of a 9-month-old, of a 15-month-old, and earlier. There also is research that tells us that there are certain groups of people that we're more likely to overlook abuse in, and one of those groups are Caucasian children, those who are in so-called intact families, meaning the mom and dad live together in the home with the child, middle-class, well-educated parents, or basically any family that we perceive to be similar to our own. This can be an uncomfortable topic to address, but it's very important for all of us to understand that we have intrinsic internal biases that affect our ability to pick up on and to consider the possibility of abuse in every child that we care for. When it comes to talking with verbal children about how their injuries occurred, it's perfectly okay to ask open-ended, non-leading questions. We'll have some examples of those here in a minute. We want to stay casual and conversational and not make the child feel like they're being interrogated. Otherwise, that might frighten the child or further traumatize them. We want to document both what the child tells us, but also what questions we ask them as soon as we possibly can after our conversation. And this includes as close to word for word as possible. And then finally, one of the most powerful tools we have in helping keep kids safe and promote resiliency is simply to let the child know that we are available for them to come talk to us if they ever decided they had something they wanted to talk about in the future. The research on resiliency in children who have experienced adverse childhood events has shown that having an adult express concern and the availability to the child is one of the most powerful predictors of resiliency in young children. Here are some examples of safe, non-leading questions that we can ask of young children, really children of any age, if we notice that they have an injury or any other finding that makes us concerned about their home life. One of my favorite ones is simply, do you feel safe at home? When it comes to reporting, it's important to understand that here in the state of Kentucky, any person with a reasonable suspicion that child maltreatment is occurring, that includes physical abuse, sexual abuse, emotional abuse, or neglect, must immediately report to Child Protective Services our concerns, and the number for that report is on the screen. When it comes to making a report to the Child Protective Services hotline, it can be very helpful to make sure that you give them your name and the organization you're calling from. In other words, let them know that you are a child care provider. That you are a professional taking care of the child brings with it credibility that will help Child Protective Services know that this is an important call that needs to be responded to. Although you can remain anonymous, it really helps CPS in their investigation if they're able to circle back and ask you questions afterward. They're going to want to know the child's name, where they live, where they can find the child, and then the specifics of your concern. If you're seeing bruising on the child, describe where the bruising is located, how bad it is, and if you're worried for the child's life, say so. Let them know your level of concern. Also, if you happen to know of younger or older siblings that are in the home who may also be at risk, this is worth mentioning as well. So the take-home messages here are that bruising in babies is never normal and needs to be reported immediately. Remember the 10-4 bruising rule to help us decide which bruises we need to be concerned about. We need to be careful not to attempt to date bruises, but only describe them by their color and their location and their shape. It's okay to talk to young children about their injuries as long as we're asking safe, non-leading, open-ended questions, and it's very important to document clearly any conversations we have with children and any incidents that happen in the daycare or child care setting so that we know which injuries the child came with and which injuries may have occurred at the center.
I'm Pam Darnell, President and CEO of Family and Children's Place. While not all children who exhibit these behaviors or traits have been sexually abused, there are some common behavioral indicators. Difficulty concentrating or staying on task, agitation and irritability are common. Lacking motivation and showing little or no emotion may also be signs of sexual abuse. Unexplained episodes of anger, rage, or moodiness may occur. A child who has been sexually abused may make strong efforts to avoid or to be with a specific person without an obvious reason. Behaviors such as not wanting to change clothes in front of others or participate in physical activities may be other indicators of abuse. Being consistently dirty, lacking sufficient clothing, or begging for food or money may also be indicative of sexual abuse. Sometimes children experiencing sexual abuse assume more of a parental role with younger siblings, often as a protective measure. Play may be absent or may be violent, or the child may engage in play persistent with sexual themes. Some children experience nightmares and sleep disturbances and may regress to bedwetting and other behaviors too young for their current developmental level. Infants may display changes in appetite, a total loss of interest in food, unexplained gagging and vomiting, and other symptoms related to emotional stress. Another indicator is when a child displays knowledge or interest in sexual acts that are inappropriate to his or her age, excessive masturbation, or even displaying seductive behavior. Sudden changes in behavior may occur, such as becoming more withdrawn from normal or routine activities, being more aggressive toward family, friends, pets, or toys, or unexpected changes in learning activities. The child may not want to go home with their parent or caregiver. The child may express feelings of hopelessness, depression, or self-hatred, and may even talk about death or actually harm themselves. Physical indicators may include unexplained injuries, pain when toileting, and trouble walking or sitting. Pain, itching, bleeding or bruising in or around the genitals, or a sexually transmitted disease or infection are all red flags that need immediate attention. Sometimes a parent's demeanor or behavior sends red flags about child abuse. Warning signs include parents or caregivers who do not provide adequate adult supervision or who are emotionally absent. These parents or caregivers often isolate the child from others, including peers. They may show little concern for the child, seem unable to recognize physical or emotional distress in the child, and may offer conflicting or unconvincing explanations for a child's injuries. If staff or teachers see these adult behaviors, they would want to consider if they have observed any of the other indicators already mentioned. If several indicators, along with these parent or caregiver behaviors, have been observed, the staff would want to consider calling Child Protective Services. If a child discloses abuse, it is critical for you to stay calm, listen carefully, and be a source of safety and support. Manage your own emotions and do not overreact or underreact. Be aware of what your tone of voice, body posture, and expressions may be communicating. The child needs you to be the adult, to be in control, and to provide safety. How you respond will influence what the child chooses to tell other people about the situation. Allow the child to share at his or her own pace, using his or her own language. Do not press the child for details. Do not make remarks that question the child's experience or even confirm the experience. Just let the story unfold. Use your own experience to help you understand what the child may be feeling, such as fear, hopelessness, shame, or guilt. It is okay to ask feeling-oriented questions that allow the child to share their experience safely without asking specific questions about details. You may make supportive comments such as, "I'm sorry that happened to you. I understand what you are saying. That must have been difficult for you. I can understand how you might have felt afraid or confused or angry. How did you feel? How do you feel now? You sound like you feel angry, sad, confused, or scared. You look angry, sad, or confused." It's okay to feel angry, sad, or confused. Assure the child that their feelings are okay. Most importantly, assure the child this is not their fault. Thank the child for telling you and reassure him or her of your support. Do not promise to keep something just between you and the child. Do not ask for additional details about who, what, when, where, or how. That is the job of the investigators. Do not try to sort out what is true or make discounting statements such as, "Are you sure you did not misunderstand?" or "He or she would not have done that. You are wrong." Or, "That isn't that bad. It could have been worse." Your job is simply to listen to the child. Call in the report immediately. Document your actions and follow the policies and procedures of your center.
Thanks for watching. To learn more about how you can be the face that ends child abuse, visit faceItabuse.org. I also encourage all Jefferson County licensed and certified child care providers to become a member of the Kentucky Shared Services Portal, where you'll have free access to several child care resources, including tips and tools on child abuse and neglect prevention. To sign up, visit www.kentuckysharedservices.org. One case of child abuse or neglect is one too many. Let's join together to ensure all kids are free from the tragedy of abuse in our community. Help us face it and end it.